Well, this is an ultrasound study of a 26-year-old male. He's married since last 3 years and has no kids. There is a complex cystic and solid mass seen that originates from posterior to the urinary bladder, and the is separate but adjacent to the separate from the prostate gland as well as from the seminal vesicles. They are also spared, and this is the mass. It measures approximately 19.3 centimeters in length, and this is the width, approximately 60 to 70. This is 72 from here, and this is about 6.0 centimeters. Now you see this is a fluid pocket at the medial end, and there is a solid element. This is an ecogenic area within it. It's very well demarcated. Its wall, this is the wall. The wall is approximately 4.4 millimeters, and the rest you can see that there are multiple hypoechoic areas interspread throughout this solid mass in the extending from the pelvic region, and then in the midline it extends up to the just below the pelvis, and then extends on both sides of the midline up to the pubic region. Now this is the urinary bladder, this area. This is the urinary bladder. This was to make the things bit simple and to hurry up with this ultrasound of this gentleman. Now there is no, now you see this mass. What you want to see, this is the urinary bladder, and here comes the seminal vesicles. This is the urinary bladder. These are the seminal vesicles, and here comes the prostate. This is the prostate in transverse section, and if you will see that it spares the prostate. This is the urinary bladder, this is the prostate, and this is the mass. From here, it extending here. So, sorry, this is all mass, and there is an ecogenic area, which is a calcification. Now this mass, now I am moving the probe in the midline up to the umbilicus. Here I am at the region of the umbilicus in longitudinal section, and you can see this mass. This mass is not so vascular. Vessels are seen, but here tiny calcifications are seen. See this one, this area is suggestive of calcifications, tiny calcifications. No significant blood supply seen. Now these are the iliac vessels on the right side, these ones. These are right-sided iliac vessels. So no significant blood supply. Now from the umbilical region I am going to move the probe downwards towards the pubic region. Here comes the mass. Here I am coming downwards. You can see the location of the mass. This is the urinary bladder, and when I move the probe a bit upwards towards the head of the patient, and I see the mass. It's well demarcated, as this is the outer covering of this mass, and cystic area, solid element, ecogenic areas, suggestive of calcifications, urinary bladder, and see the amount of calcification: 1, 2, 3, 4, 5, 6, 7. and this mass has no relation with the urinary bladder, with the seminal vesicle, nor with the prostate, and nor it is a cut-related mass. It's not an ileocecal mass because the patient is tender to this region when pressure is given, not otherwise. Because the ileocecal mass, had it been an ileocecal mass, it would have not extended towards the midline, and here I can trace it up to the left suprapubic region. This is the left suprapubic region. So this is from the left suprapubic region. If I give a sweep to the probe into the center, then towards the right side, so the ileocecal mass or a bowel mass would have not extended in this fashion. Now the thing is that this gentleman, his suprachoroidal sac is empty. There is no testis seen in the suprachoroidal sac. Penis is well developed, and these are actually the retained testes that have developed into both testes. Yeah, these are in fact, this mass is in fact suggestive of matting of both testes together and then converting into a mass that we are seeing, and it is a bit vascular, not highly vascular, but at this region it is. Yeah. So vascularity is seen. From this angle, it is the vascularity is seen. Now you see the left-sided ileocecal vessels. Left-sided iliac vessel. Yeah, these are the left iliac vessels, and here you will see the right iliac vessels. This is the right iliac vessel, and this is the mass. It is not highly vascular, but is vascular, we can say. This is the longitudinal section in the midline, and this is the umbilical region. So testes absent. Both testes are absent from the suprachoroidal sac. Penis is well developed, and this is a mass which is suggestive of testicular pathology. Rest of the ultrasound is normal, nothing significant seen relating to the kidneys. Thank you very much.